everyone, I'm Elizabeth McKenna, Executive Editor of Cancer Discovery. For this OncoAlert academic recap, I'm pleased to present some clinical studies recently published in the journal. First is intraventricular B7H3 CAR T cells for diffuse intrinsic pontine glioma, preliminary first-in-human bioactivity and safety by Nicholas Vitanza and colleagues. In this study, the authors designed and confirmed the preclinical efficacy of CAR T cells specific for B7H3, which is expressed on CNS tumors. They also report the results of the first 3 evaluable patients with DIPG from Brainchild 03, a first-in-human phase 1 trial administering repeated local regional B7H3 CAR T cells to children with recurrent or refractory CNS tumors. These patients received 40 infusions with no dose-limiting toxicities, with local immune activation and persistent cerebrospinal fluid B7H3 CAR T cells, providing preliminary evidence of tolerability and feasibility of the approach. One patient had sustained clinical and radiographic improvement through 12 months on study. Next is osimertinib plus savolitinib to overcome acquired MET-mediated resistance in EGFR mutated MET-amplified non-small cell lung cancer by Ryan Hartmeyer and colleagues. This paper is the final analysis of parts B and D of the phase 1b TATAN trial, in which patients with EGFR mutant advanced non-small cell lung cancer with MET amplification or overexpression following disease progression on a prior EGFR tyrosine kinase inhibitor received savolitinib plus osimertinib. In patients previously treated with a third-generation EGFR tyrosine kinase inhibitor, the overall response rate was 33%. Among the cohorts with no prior third-generation EGFR TKI treatment, the overall response rate was between 62 and 67%. Biomarker analyses indicated that increased anti-tumor activity was associated with higher MET copy number, and that acquired resistance to osimertinib plus savolitinib was mediated by MET, EGFR, or KRAS alterations. Clearance of EGFR mutant circulating tumor DNA on treatment also predicted longer progression-free survival in patients with detectable baseline ctDNA. Next, genomic instability and protumoral inflammation are associated with primary resistance to anti-PD-1 and anti-angiogenics in malignant pleural mesothelioma by Francois-Xavier Downlos, Aurélien Marabel, and colleagues. Here, the authors report the safety and efficacy of nintedanib, a pan-anti-angiogenic TKI, in combination with pembrolizumab in patients with advanced pleural mesothelioma naive to immunotherapy and previously treated with at least 1 line of a platinum-based chemotherapy regimen as part of the multi-center phase 1b PEMBIB trial. Longitudinal analysis of blood samples and fresh tumor biopsies revealed that resistance is not due to a lack of tumor T-cell infiltration, but rather due to adaptive immunosuppressive pathways by tumors, involving molecules such as IL-6, CXCL8, VEGF, and CTLA4 that are amenable to targeted therapies.